So what we're talking about, you have pictures, even this time, on page 2 and 3. There's a discussion of what it is on page 2, and pictures on page 3. So we're talking tonight about total artificial hearts. This is an interesting and increasingly relevant topic, and as you'll see, it gives us an entree to discuss a number of very important issues in Jewish medical ethics. So it becomes a case study. And it's something that's growing in popularity and in utilization. I'll tell you a story that happened that we had in the hospital that is what really got me thinking about it. And I'm telling it to you just so you know. I'm going to tell it to you with detail, but I'm actually changing some details in case anyone were to hear the story. I'm changing details that would make it impossible to know who the patient is because I'm lying about a few things. But the medical parts, I'm not. That part is all real. I'm changing some details. Just so you understand, I'm not telling you, protected health information here. But imagine the following case. You have a patient who is brought in for a heart transplant. Now, people, as is what I have on the first page here, there are 4,000 patients on the heart transplant waiting list, right? Waiting for heart. 4,000 people. This is just the United States. But there's only between 2,000 and 2,500 hearts transplanted a year. It's not so easy to get a heart that's transplantable and that's a good fit for somebody. So about 25% of the people on the waiting list die every year waiting for a heart. So if they don't have a heart, they die. So there's a few things that can be done. One of them, this is what you have in the pictures. I'm just giving you this background to the story. You have in the pictures an LVAD and a TAH. An LVAD, it really could just be VAD. It would be probably more correct if I would have just put VAD, a ventricular assist device, just most commonly LVAD, right? This helps the heart pump. It helps the circulatory function, right? You see the picture. It's a mechanical pump. It's connected, as you can see, to a ventricle, usually to the left, and also then to an aorta. And it supplements the heart's ability to pump. If a person has heart failure, their heart can't pump blood throughout their body, it helps that happen. Artificial heart, on the other hand, you see it here, picture of it. This is a much better picture than I used on Facebook. Whoever saw the Facebook ad, and that's why they came. I just did a quick Google search to throw that ad out there, but this is a really good picture. An artificial heart takes over entire cardiac function. Both ventricles are removed, left and right, completely removed, and it's replaced by this artificial heart, right? And the idea is, as you have on the on the second and third page, the idea is if a patient can't make it long enough, they're waiting for a heart, but their heart is too weak to wait that year or 2 or 3 or 4 that it's going to take for them to get a new heart, so they can actually decide to have their heart removed and replaced by an artificial heart. So this patient that I'm referring to, that's really what got this ethical debate happening and got me focusing on it. This patient had their heart removed, right? They have an artificial heart now. And then they developed kidney failure. So they're on permanent dialysis. They were unable to breathe on their own, so they're on a respirator. You see it, and it goes on and on like this. As more and more artificial interventions kept on being added to keep them alive. At a certain point, their body began to decompose. Their limbs, their extremities were like shriveling up. This was a person that had no chance of heart transplantation anymore. This was becoming a corpse. But how do you define death? I mean, in America, there's 2 ways of defining death, right? Cardiorespiratory criteria, the heartbeat, or neurological criteria, brain function. So this patient was not brain dead. And you can't say their heart stopped because their heart will never stop. It's a pump, right? It has the battery. The battery actually comes out of the body, the battery pack. You can imagine, we think it's important to keep our iPhones charged. And you know how anxious you get when your iPhone gets like below 25% or so. Imagine your heart getting low. You can't have a heart that's low on battery. That's pretty serious. There's sheets up here in the corner. So this patient is now basically a corpse. Now this patient happened to be that they're able to afford the more than $1 million a month that they're paying out of pocket for this treatment. It's actually interesting, as a side point, I called the rabbi. This patient hadn't asked for me to ask this rabbi, but I was starting to send the question to different rabbinic authorities. I called one rabbi in the neighborhood, and I said to him, we have this patient. They're paying $1 million a month to be here. Otherwise, they probably would have let him go already. What do you think? I mean, halakhically, at what point can we turn off their heart? So he said, it's a good question. I think you should, but I think you can just send it to my shul and we'll take them. Obviously, he was joking, but for $1 million a month, but it was a joke. But it became a big dilemma. What are you going to do? You have a corpse that you're artificially sustaining, their heart, their lungs, and their kidneys. And as long as their brain is functioning, I mean, they're technically alive, at what point can you deactivate it? This dilemma becomes very excruciating because that patient was totally unconscious. They weren't able to participate in the decision making. But let's say, sometimes artificial hearts, the Mayo Clinic just did a study. This just got published. Yeah.
You said the brain was functioning. Why do you say he wasn't able to participate?
No, there was some brain function, but he wasn't conscious. Meaning there was brain function enough that he wasn't brain dead, but he wasn't able to carry on a conversation. He was comatose, but alive, according to certain ways of looking at it. So, the study that came out of Mayo Clinic just came out a couple months ago, where they're doing a lot of artificial hearts there as well. They found that 30% of people that get artificial hearts do not make it to a transplant. 30% they have to deactivate. That's a pretty high percentage. 3 out of 10 who get this intervention are going to have it deactivated at some point. Now, anyone have any guess what happens when it's deactivated? What do you think happens? Yeah, they're dead immediately. Immediately, right? Obviously, you're turning their heart off. There's the sheets are up here. I'll summarize again, just for those of you who are still coming in, so you understand where we are before we jump in all the way. You'd have to turn their heart off. They're dead instantaneously. It's like a light switch. It's like you turn on the switch in this room, the lights go off, they'll be dead immediately, right? So imagine. So what do you do? The person gets the artificial heart. The goal is they have the artificial heart. Their goal is that they are going to get a transplant eventually. But they don't give a heart to just anybody. You have to be a fitting candidate to receive a heart because hearts are precious. There's, as we mentioned, 25% of the people waiting don't get one. They die. So you're only going to give a heart to someone that's really healthy enough to be able to live with it and sustain it. So what do you do, for example, if the patient gets an artificial heart? They go for a year, and then they get diagnosed with a terminal diagnosis. And they only have 3-4 years to live. Are you gonna give them a heart? Or what if one thing that sometimes happens as a result of these artificial hearts is strokes? What if they have a number of strokes to the point where they are also, they're alive still, but they're not able to participate in decision making and their health care. What if they get infections? Obviously, anytime we put something in someone's body, there's an infection risk, right? Well, now you have a new heart in their body and a cords coming out for their battery pack. There's a high infection risk. Sometimes they get severe infections to the point where it's so infected that there's a recognition that there's not going to be a candidate for our transplant. But they're still able to walk and talk and think about this, but they're not going to. It's not. that it's limited. So we have had cases where people have literally decided to turn it off. So they literally say, can I at least, go for a walk or something. They go for a walk. They can sit down and have a cup of coffee. They can have a conversation and then say, okay, let's go turn it off now. Can you imagine? This is what happens. And they go sit down in the room. Usually they do get some sort of palliative care at that moment, but they just literally go from talking and walking and having a conversation to having someone turn themselves off, and they literally are gone the next instant. But on the other hand, these things can save their lives and prolong their lives. It's a wonderful, wonderful potential, incredible technology. But the dilemmas that they bring up are excruciating, very difficult ethical, moral dilemmas, right? You understand? So just for those who came out, just do one more quick summary, and then we'll jump into the debate. And what I want to share with you tonight is both the debate in Jewish law and in secular literature. Secular medical ethicists are also struggling with this because this is a very difficult case and very common, becoming more and more common. So it's a complicated debate. We'll discuss it also, and I'll share it with you. So one more time, just a few of you just walked in. So just basically what we're talking about is artificial hearts. that there is the possibility that someone who has heart failure, their heart is not strong enough to pump blood throughout their body, and they are waiting for a new heart, but it takes a long time sometimes to wait for a proper heart that's a good fit. So there is a possibility today. One thing we've had for many years is a VAD, a ventricular assist device. You have the picture of it on page 3. That's just to assist with the pumping, but it only helps, a certain amount. If that's still not enough, another option is an artificial heart, where they actually remove both the lower ventricles of the heart and put in an artificial heart that does all the pumping for the heart, and that can keep the patient alive longer. Of course, it's a very big decision to make, because a person has to remove their heart to do it. So, and 30% in a recent Mayo Clinic study of those who had the artificial hearts implanted did not survive to transplantation. Either something else happened to them and they died, or they decided at a certain point to have it turned off. So it's fairly common that they don't make it. But it can also take people who would not have survived the 2, 3, 4, 5 years to transplantation. It gets them to that, and then they get the transplant and they live a healthy life. Or it is approved by the FDA. There are some that are destination technology. They can live out their life, the rest of their life on them, with the battery pack, keeping it charged. But they go about their lives with the artificial heart. So you see, this is a life-saving, life-prolonging technology, but it brings up very challenging ethical, moral, religious dilemmas. That's the issue. Any questions about just the basics before we jump into the debate about what can be done about turning it off, deactivating it? Make sense? Got it? Okay. So let's go to, you see the picture there. The LVAD, by the way, what happens is with the LVAD, I told you, artificial heart, if it's turned off, the person's dead. They turn them off, and they're literally turning the person off. It's very sad. An LVAD, if a person has heart failure, if they turn off an LVAD, it will also lead to death, but it's a much slower process. Obviously, it takes a number of minutes or hours, but it's still not immediate, which might have ethical ramifications. So if we turn to page 4, I'll share with you the first debate in secular ethical literature. Again, this is secular medical ethicists around the country, what they're writing about this. We're going to talk about Jewish second. We'll start with the secular ethicists, and then we'll get to Jewish medical ethics. But the first question is this considered euthanasia? Now remember, euthanasia is illegal in California. There's places where it's legal, but in California, what we talked about 3 sessions ago was assisted suicide. That's legal. It's legal for a doctor to prescribe a terminal patient a medication that they self-ingest that will kill themselves. That's now legal in California. But that's not euthanasia. Euthanasia is where the doctor actually kills the person, right? That's illegal, and that's an ethically charged issue. And so the first question is it euthanasia when the person's artificial heart is turned off?
Versus withdrawal of treatment?
What do you mean?
Well, there are some people who feel that when a patient is in a grave condition and there's no hope for recovery, they'll withdraw certain treatments.
Right.
Whether that's a feeding tube or whether that's even intubation.
Excellent.
So in this case, could shutting off the heart be considered like withdrawal of care?
Right. Is it considered withdrawal of care? That's an excellent question, and that we are going to come to. So I'm going to table it, but that's exactly where we're going with this. Can we compare this to extubation, removing a respirator, removing a feeding tube? Is it withdrawal of intervention, or is it killing the person? Because, right, this is part of the debate, which we'll come to. But I see the word you're using, withdrawal. It's hard to, it's not actually withdrawal because you're not withdrawing everything, you're turning it off, but in a way you're withdrawing the intervention. So how can we conceptualize it? Yes, we'll discuss that. Good.
Shouldn't we remove the financial issue from this? I know it's an issue, but in terms of the ethical thing of ending the life, should it not be based upon the finances?
Why do you say it's based on finances? Because of the story that I told?
You said it costs so much per month.
Yeah.
A lot of times when something's very costly,
Yeah.
I see how that influences decision makers.
Right.
Insurance companies, governments.
Yeah, it's a good point, especially if it's a resource allocation issue. If one patient's not getting the proper care because this patient's getting so much attention. But right now we're talking. Let's just stay separate from the financial issue.
That's what I'm saying.
The reason why the money was an important point in that case that I brought up was because it went on for so long. It went on for months and months and months, probably longer than it would have gone on. But because the family could argue, look, we're paying for this. We're not relying on you to pay for it for us. We're paying the millions. It ended up being tens of millions of dollars that they paid cash for that. So they could argue, don't worry about it. We're covering. We got it. We're covering it. But let's stay separate from that issue for now. Okay, so the euthanasia question. So let's look, I put it in two columns. Let's first hear the arguments of those who say yes. I'm talking again, secular medical ethicists. Some say, yes, this is killing them if you turn it off. Euthanasia. Why? One philosophical argument that they've brought up, I find this to be just a fascinating way of looking at this, is that you can divide all interventions, like you mentioned, respirator and feeding tubes and dialysis, all of these things, you can divide them into those which supplement our natural capabilities and those which replace them. Replacement would be like a transplant, right? Like a kidney transplant is replacement technology, right? Supplement, is like a respirator. It helps to force the air and helps the person to breathe, but it's not replacing their lungs. It's not a lung transplant.
Yeah, but if you have somebody with complete kidney failure, you put them on dialysis, that's a replacement.
Yes,
it's just
right.
external, it's not internal.
Right, I agree.
Somebody who has respiratory arrest and you put them on a ventilator.
Then it becomes replacement, you're saying.
Still a replacement. It's
Right.
not-
Yeah, so the same intervention could sometimes be a replacement and sometimes be a supplement. How about an artificial heart? I mean, is it ever a supplement? Can we say that it's a supplement if it's actually one's heart is removed? Yeah.
What if you transplant the heart? That day you find out that patient actually has a terminal illness unrelated to the heart.
Right.
Do you take that?
Once you've already put the heart in?
Yeah, is that different than the artificial heart that you would turn off?
It's an interesting question. We're going to actually discuss an issue very related to that. So maybe we'll say, well, that's an interesting question. That would be interesting. Like, let's say when they're doing some kind of x-rays during the surgery, to make sure everything's going in properly, and then they catch something else right then. But I can't imagine, that's such a complicated decision to make that decision in the operating room,
Of course, but
especially after the surgery, when how usable is that heart having already been removed, transplanted, and then to remove it again?
at what point would you stop the transplant?
Right.
Would you stop it in the
Right. See, that's an interesting question. It's a fascinating question. It's different than the artificial heart because what we're talking about here is the person's just on a list and they're just being ranked based on a whole number of factors about how much they are appropriate to get the next heart, and you can just adjust their ranking based on things we find.
Is the transplant really different than the artificial heart? Are you not putting it?
It's interesting. It's just, I think it's morally different to take a heart from someone, to take it back, than to not give it to them.
Of course.
Right.
But if you found out on the way
Right.
to
It's a
the
fascinating
OR,
question.
you would stop and not give it.
Maybe. Yeah. Probably. Right. Yes. Interesting.
I'm surprised that the secular people didn't put into the equation the mental status and the ability to relate to the world, or they're completely comatose in terms of whether it was ethical or not ethical.
Uh-huh.
You would
I'm
think-
sure some
I'm
do
not
that.
getting to Halakhah right now, I'm just saying.
Right.
The secular, I imagine the secularists would weigh that in more heavily.
Right. Possibly. Probably. So this is one argument. One argument from those who say that, yes, this is euthanasia to turn it off, say this is replacement therapy, not supplementing. Therefore, since this has replaced the heart, to turn it off is like actually, the article that I read, it's like it's akin to opening them up and removing the heart from a living person. Turning it off is like taking their heart away. That's one argument that some have made. And they argue to turn it off is euthanasia. Another argument is that it depends on, it's a similar argument. It depends if they have anything to fall back on. So in most cases with the respirator, unless they have no ability to breathe whatsoever, at least if you extubate, you remove the endotracheal tube, they at least have something that they could potentially fall back on. But the question with the artificial heart is that there's just nothing, you don't give them any chance whatsoever. You are literally turning them off. You've there's no chance that they have to live, and so it's euthanasia in that way because there's nothing that they can fall back on. That was another argument that has been made. And finally, there's an interesting debate between, for example, do not resuscitate. You all know this phrase, DNR, do not resuscitate. There are those who advocate for us referring that to A&D instead of DNR, A&D, allow natural death. Because they feel that people will be more likely to agree to it if they see it as just allowing death to occur rather than, oh, I have a chance to resuscitate? Why wouldn't I try if I have a chance to try? So yes, let's do it, even though the odds are very low and there'll be broken ribs or whatever might happen. But, so anyways, is turning off an artificial heart allowing natural death, or is it assisting in the dying process? That's another philosophical debate that they have. And many have argued, again, secular medical ethicists, that no, if you turn it off, that is assisting in the dying process. It's not allowing nature to take its course. Because you're doing something and then they're dead. Yeah.
Do they make a differentiation between actually turning off the heart versus allowing the battery?
Yes, good. We're going to come to that, but yes. So one possibility, I never saw this in a secular thinker's writings because this is starting to get nitpicky, but in Jewish thought, this is exactly where we go with it, which is, yes, it could be morally different, even though people might think it's strange, but instead of turning it off, allow the battery pack to run out. And at least experientially it's different. It's just saying, okay, we are not going to do anything else here. It's different than turning them off. Yes, I haven't seen that in secular thinkers, but I've seen rabbis talk that way. Yes, Dr. Smith.
Yeah, we make this distinction between sins of omission and sins of commission. I'm not so sure that it's so different.
Okay, Jewish Law thinks they're different.
I know.
Yeah. It's a big debate. A lot of people think. I agree. And there are rabbis. I mean, a lot of people think that there's no difference between withholding and withdrawing. But we'll talk about this more soon. Good question.
Are the secular ethicists talking about a patient who has a terminal illness and is seeking euthanasia, or like for other reasons they want to die? Like, or do they talk about the circumstances of this?
Every article I read was just in general. Is it ever okay to deactivate an artificial heart?
Well, I mean, if they're saying allow natural death, it's allow natural death that would come anyway because of heart failure, or it would come anyway because of advanced
Right.
stage pancreatic cancer, and you're suffering and you're in pain and you want to be
Right.
out of it.
Yes.
You
I
want
mean,
to be out of your suffering. To me, I feel a little bit differently about putting somebody out of their misery. As a secular ethicist, to
Yes.
say that.
then you feel a bit differently than putting them out of their misery than.
Okay. Let's say there's a patient who received a total artificial heart under the assumption that it was a bridge therapy and not
Yeah.
as a destination.
Right.
And all they really wanted in life was to not have anything in their body.
Right.
So let's say it became clear that they would never get a tissue transplant,
Yeah.
and they said, I don't want to live anymore. No,
Right.
Shut it off, right?
Yeah.
Is there something actually killing them? Because the total artificial heart is considered destination therapy now. People are allowed
Right.
to live as long as they're going to live and die from something else.
Right.
Versus a person that doesn't have this, they have another terminal illness that is killing them,
Uh-huh.
or that they're suffering from.
That's
whatever. So
interesting.
I just feel like the circumstances surrounding the reason for the euthanasia somehow
Yeah,
represent-
I hear that. That makes sense. That's an interesting distinction. I mean, this is actually what some, I see which column it's in, but, well, actually, we're going to come to that later, but there were some of them, we'll come to this in the next section, but, I mean, some of the ethicists argue, I mean, let's just use for example, terminal extubation, turning off the respirator. If a person has lung failure and the respirator is turned off and they die, what does the death certificate say they died from? Does it say they died from extubation? No, they died from lung failure. They had lung failure, which was the reason why they were on the respirator, and then it was turned off, and they died from the underlying illness. So some of these thinkers argued the person is dying because they had heart failure. Because of the heart failure, the heart was removed, and we tried this, it didn't work, so they died from their heart failure, even though they didn't have a heart anymore to fail, but they only got into the situation because of their underlying illness. That could be another way of.
Well, if you ever have, I assume you would never sign a death certificate. They ask you what was the first cause of death, and they ask you was that for minutes or hours or whatever, and then they say what's underlying that, and then what's underlying that.
Oh,
Does
interesting.
that make sense?
Yes.
Yeah.
So you put both. You put underlying, and then you put.
Yeah, you put as many as are
Yeah,
relevant. Because
interesting.
of this, X because of Y, X because of Z, like that.
Interesting. We'll talk about more, but your point made me think of that. That was an interesting point. Let's see the no. Did you have it, Dr. Rogers? Did you have a? Okay. Let's see the no. Those. And by the way, I read a lot of articles on this. I probably read 25 articles on this topic to kind of come up with these summaries. The no call that this is not euthanasia was the vast majority. So there's 3 or 4 articles that I read that were arguing against this from the secular perspective. Then there was a whole lot that were saying, no, it's not. It's not euthanasia. What was their argument? Argument number 1, euthanasia requires 2 things. It requires that we do something, like a new intervention. I inject a drug or pull a trigger. I mean, we wouldn't do that obviously, but you do something that to cause a death with an intention of killing. That's euthanasia, right? I administer a new intervention that has the purpose of ending life. Stopping an artificial heart is the intention, like was mentioned. The intention is not to kill them. In most cases, I mean, your distinction comes up again here. But if the intention wasn't to kill them and it wasn't a new intervention, so they argue this. You can't say that that's euthanasia. They died from the pre-existing heart failure. Again, along those lines, when people, the artificial heart, the argument number 2 I have here is that, people have this right to informed consent, informed refusal, and autonomy, where they decided to undergo an intervention where they would get an artificial heart, but they only wanted to do that dependent on the benefits and burdens. And once they see that the burdens are outweighing the benefits, they can say, well, I didn't sign up for this. I signed up for a different goal, and this is not where it's going now. And so now I want to change my mind about what I did. But it's not that they're then killing themselves. It's that this is not the direction they wanted it to take. And the final point they make is that they see it as deactivation as simply allowing. Not just, as we said, allowing the battery to run out. They say, no, the deactivating of the heart is their body was dying. Then we did something artificial to stop it, and now we're removing that artificial impediment, and they see that as not euthanasia, allowing natural death. That was the argument of the secular medical ethicists. Yes?
So I'm not sure where I would put this, but when you sign a consent, you say the good things and the bad things and so on.
Right.
Could there be such a thing as a consent that lays out the conditions such as you're pointing to?
Yeah.
And say, I consent only if it ends up in this and this and this.
Right.
Otherwise, at some point where this is not going to happen, I withdraw my consent.
Right.
And I don't know.
Yeah, well, that's part of my argument. That's going to be part of my
No, not
conclusion.
about shutting off the heart.
They're revoking your consent.
Right. But the key here
The
is,
doctor's not making that decision, the person did it.
yeah, the
and they
person
signed the
can
consent.
decide that. The key is, though, that they have to know, that it has to be true informed consent. This is one of the issues that we've been struggling with, is that the person at the time of implanting the artificial heart needs to know all the possible ramifications. They need to know the fact that it doesn't always go well and what that means. And they should have thought through that at the beginning. Instead of it being like, oh, wow, we have this thing, let's try it, we can do this. And then it's like 2 months later, oh, wait a second, I don't have a heart anymore. And that was a big kind of life-altering decision that I made. And now I'm trying to realize that there are some ramifications to that. Like, no, they have to think about that beforehand. Right.
Do the patients go through evaluations for
Yes.
part of the heart the way they do for transplant?
Yes. And I'm not sure that was always true, but it became more and more as as professionals saw how challenging these issues are, they began to realize we need to be more careful about when we go into this, and then making sure that people have an evaluation and that they're appropriate and that they're prepared for this. Yeah.
So, patient has renal cell carcinoma, and patient only had one kidney. And the patient consented to have that kidney taken out, knowing that they would end up on dialysis. Then they don't like dialysis.
Right, it's a similar.
They revoke their consent and say, no, I want to die now.
Right, it's very similar, as we're going to see, and it's going to come up to dialysis in a minute. It's a very similar question.
And who turns off that switch?
Technician.
And the technician doesn't feel like they're killing the patient?
Well, I mean, some do and some don't. If they feel that's killing, then they're not going to want to do it, and they don't have to do it.
But if they're going for dialysis, that switch
Yeah, if you're back to the heart. So yeah, you're right. Some people will not feel comfortable doing it, and then they won't do it. We've had people who refuse to do it, and they don't have to do it.
Because you know that the patient dies.
Yes.
So you cannot say, well, it's not.
Right. This is why this is different. Exactly. Yes. Is there a hand?
Well, it sounds like we're giving ourselves a second chance at life or death.
Right.
We're messing with Hashem.
Right.
Whereas you knew you were gonna die the other way. That's the all natural death.
Right.
But you've already been given an option and made a choice.
Right.
Now you chose you don't like it anymore, or it turned out different
Right.
than paradise.
Right.
So, you know what? Let's go back.
Right. Well,
You can't undo what you did.
well, you can turn it off.
Well,
I mean, this is a challenge. This is always medicine, right? I mean, we always are intervening and trying to. God said someone is going to die, but actually we have an intervention to prevent that, and that's a mitzvah for a pro yarpeh. We try to prolong life, but then you're right. Sometimes people say, "Wow, maybe I shouldn't have done that." This is why the question always is: just because something can be done, should it be done? We believe in medicine, though. We believe in trying to prolong life, improve life, make life better through aggressive interventions. But you're right. Sometimes then afterwards we realize that might not have actually been beneficial.
I mean, there's very strong evidence that when a doctor lays out percentages, patients actively minimize
Uh-huh.
the low risk things
Right.
and exaggerate the beneficial outcomes.
Right.
So to think that somebody would have been like, oh, it's going to be panacea, and then isn't all of a sudden, is not their own fault. It's
Yeah,
actually just
that's a
the
good point.
psychology of accepting a risk and you're going to die unless you do this. I think it's very hard to accuse them of to accuse them of doing something wrong by flip-flopping. It's
Right.
impossible for them to understand. Doctors, we do it every day, but a patient, this is probably the one and only time that they've ever seen this.
Right.
It's not even the same as seeing somebody go through cancer, because you see this person go through cancer. Who in this room ever saw a person have a total artificial heart or a heart transplant? Me, I'm a doctor, you're a doctor, or whatever. Other than doctors,
Right.
probably no.
Right. Right, and even seeing it, to be the one, then to have it done to you, I'm sure is going to be very different than you could have expected.
And doctors even have a better understanding of,
Right.
of how appropriate a percentage is, and even then, doctors also minimize.
Right, right.
So with all due respect, I think it's hard to say what you said about that the person should just accept the choice that they have made, because patients don't always understand if they're getting, I guess,
Right. I see what you're both saying. I mean, it's a challenging dilemma. Yeah.
Patient who's alert, comfortable, receive the artificial heart,
Yeah.
no chance for transplant.
Right.
What kind of argument could you ever give for turning that off?
For turning it off?
Yeah.
This is the argument. They
The person accepted the artificial heart, anticipating it as a bridge to transplant.
Okay.
Right.
Something happens, and then they are told, Mr. Jones,
No, I
Mr.
understand
Smith,
the
Mr.
situation.
Schwartz, you're no longer a candidate, we're not gonna ever be able to transplant
I
you.
understand that.
And now they have to be faced with, well, am I gonna live the rest of my life with this thing hanging out of me, subject to all the risks?
But they're
Right.
comfortable,
Well,
they can think, they can interact with their
And
family.
they're able to make an informed decision at that point.
Right.
With all their faculties.
Right, I could see your argument, like how can you defend it? But I could also, I mean, and probably from a Jewish law point of view, it would be very difficult to defend. But I could see why I can see logically the logic of why someone would just think like, I didn't sign up for this, or this is harder than I thought. This is not what I want to do for the rest of my life, and I just had enough. And they can see it. They can easily justify why this is different than putting a gun to their heads. They don't think they're doing that. They're just thinking to their head, not heads. But,
I think the arguments are stronger if you say they're comatose.
all right, okay, then it's
Can't
stronger. But I can still see why
they can't
someone could
interact-
have the argument.
They can't interact with their family or anything else, question about his life and so on.
Right.
But where they're perfectly okay, except that they have artificial.
But obviously not perfectly okay. There's some reason why they can't get the transplant. There's something wrong, right?
Yeah.
Yes.
I have one more question about that. On a very secular level, does the state and probably very importantly the life insurance company consider that suicide?
No, it's not considered suicide.
It's if they turn off their own heart.
Right. It's not. I mean, it's not. But that's an interesting question. Should it be considered suicide? But it's considered to be stopping a medical intervention.
Well,
So it's not suicide.
Themselves and the life insurance still pays off.
Yeah. I can see why you would ask the question, but yeah. So let's look at Jewish law for a second, and then let's look at the other arguments. So would Jewish law allow, how would Jewish law look at, I'm sorry, not would it allow, how does it look at this issue of is it euthanasia or not? Is it euthanasia, right? So this is going to be much more challenging in Jewish law. We will talk about approaches, excuse me. We'll get there. But in terms of this issue, is it euthanasia? I think a lot of the distinctions that we brought up before are mostly irrelevant. Because in Jewish law, any action that actively hastens death is going to be prohibited by Jewish law, right? This is what I have, some of the outlines listing why that is, because of the sanctity of life and the obligation to attempt to save life and the prohibition against hastening death, prohibition against bodily damage, prohibitions against suicide. Judaism would say, palliative care is appropriate. People don't have to suffer, and they should be given appropriate, sophisticated pain relief, even if that has some risks. But that, even if pain isn't completely managed, there's a preference for life, with some suffering over cessation of life, with the elimination of suffering that brings. So to do an action that hastens death is almost always, I use the word almost, we'll get back to that, going to be prohibited, and it would be considered an act of hastening death in Jewish law. That's pretty straightforward. Okay, let's keep talking because I'm going to nuance it a little bit. Let's go to the next discussion. This is what has come up already a little bit. So now we're turning to page, I think it's going to be 6. Yes, page 6, which might be upside down in yours for some reason. So now we have another question. Let's start to dig a little deeper. So if we're saying that Jewish law says it would be euthanasia, and among secular thinkers, some say it is euthanasia, the majority think it's not euthanasia, can we compare this, though, to deactivating, turning off a ventilator, as was brought up? And this is another discussion that comes up in the philosophical, ethical writings among secular thinkers today. Is it the same? Because it's become acceptable to deactivate, to turn off a respirator. That's accepted. So
Not by Jewish law unless you have brain death.
we'll get there.
So by Jewish law, turning off the ventilator or turning off the heart is going to do the same thing.
Right. Possibly. We'll talk about that. Maybe. But in America, so what the thinkers want to do is they're trying to figure out, what we always do, one way of making ethical decision making is through paradigms, right? So when an ethicist, when a doctor, when anybody has to face this challenge for the first time, they think to themselves, okay, what is it most similar to? So if they say, well, it's most similar to turning off a respirator, and in a secular world, in America, turning off a respirator is accepted. You could turn off a respirator even if someone will die immediately afterwards as a result. That's okay. So now these thinkers want to know, is it even the same? Is it the same, an artificial heart as a respirator? So again, we have two schools of thought. Some who say it's exactly the same. Turning it off the heart is like turning off the respirator, the ventilator. Some say it's the same, and those who say it's the same say it's for sure allowed, right? Why do they say it's the same? Well, first of all, they say, it might be that it's, different than a respirator, which is outside the body, it just has a tube. It's inside the body. It's part of, it's like replace the heart. But they say no, but it's not physiologically integrated. It's not actually the heart. It's still a machine. That's their argument. It needs a battery pack. Your brain doesn't control it. It is a machine, they argue. And since it's a machine, it's separate from our body. Therefore, it's still like a respirator. You can turn off a respirator. You can turn off a heart. It's a machine. It's separate. Yes?
Not exactly the same, because the reason, the question is, one is, why was the patient intubated? What is the condition that they have that required the respirator? If for example, if the brainstem is affected and
Yeah.
there's no signal to breathe, you turn off the respirator, it's going to be the same thing.
Right.
They're going to die for sure.
Yes.
And you have another option. You can temporarily shut off the machine, see if they're breathing on their own.
Turn it back on.
And you can turn it back on.
The heart, you can't do that.
Yeah.
Uh-huh. Right. Okay. Interesting points. The other argument that they make that it is the same and therefore permissible to turn it off is that, like we mentioned before, that if we can say that the patient's illness, their underlying illness, is the heart disease, and they only required the artificial heart because of the heart disease, and because it became so all-consuming, then deactivating it is just simply allowing that heart disease to take their life. That's the other argument, that it's not like a respirator. That is like a respirator. Then there are those who said, no, it's not like a respirator. Yes, we agree, they say. A respirator, to turn that off and allow someone to die, that's permissible. But a heart, an artificial heart, is problematic. Why? They say 2 reasons. That they say you can't argue the patient is dying from the underlying organ failure and not the deactivation, because 1, death is immediate when it comes to turning off an artificial heart. The respirator, it's going to be very fast. It can. I'm not saying very. I'm not going to be. It can be very fast, but I don't think. Sometimes, but usually not. It's not instantaneous that you turn off the respirator and then they're dead, right? Sometimes I know that happens, but usually there's going to be slowing down the respiration, and it'll take a couple minutes, hours, days. But it's usually not instantaneous. The artificial heart, is literally instantaneous. So they argue, see, it's different. Another argument is that the respirator is put into the lungs, but the artificial heart is replacing the heart. So that's different because it's not just assisting, it is the heart now. So you're turning off their heart. That's their argument, that it's not like a respirator because of that. Let's look at Jewish law. Since you brought it up, let's jump to Jewish law, because this is going to be a few things to talk about here, and then actually we're going to wrap it up right after that with one more point, and then we'll wrap it all up, and I'll share with you some suggestions moving forward. And also, as I mentioned, I submitted this question to some leading rabbinical authorities around the world, and I got some interesting answers, and I'll share with you what they said. So,
it seems like the LVAD would be more comparable to the ventilator.
Right, you're right. The LVAD is just like a ventilator because it's external, supporting, but the artificial heart seems like it's different than a ventilator. Right. Yeah, good point. So in Jewish law, what about turning off a respirator? So the majority opinion, as was mentioned, is that a respirator that's supporting life, that a person is dependent on that respirator to live, is considered to be not just allowing death to happen, but causing it to happen. This is something that people disagree with. A lot of thinkers disagree with, but this is how we see it, that it's like a grama, it's a causation that we are turning off the machine, and therefore the person dies as a result. They might have died from their lung failure, whatever it was, but there's an action that we are doing, then it's leading to their death, and therefore it's considered to be like it's our, in the Talmudic language, koach rishon, it was like our action that led to the person's death, and therefore turning off a respirator when the person will die very soon as a result is prohibited. If the person will live for a couple days or months or indefinitely, then it's not. Even if it's only a day or two. There's a debate about exactly how long. Some say just a number of hours, some say it has to be at least a few days. But even if they will die after being extubated, but it will not be very soon, then that's a different question. But if a person will die very shortly after being extubated, it's usually prohibited. There's one school of thought that allows it. Now, I'm just going to mention it because this is going to become part of our debate. One school of thought actually allows turning off a respirator. This was published in Tchumin. It was Rav Chaim David Halevi who was one. There was a few other thinkers who endorsed this, but it became a very much like what we call a minority view that wasn't endorsed by the rabbinic community, wasn't really accepted, but the argumentation is interesting, and we'll see if it holds up, if it can compare to the heart. The argumentation is as follows. In fact, maybe I'll read it to you. I said we wouldn't read any sources, but I brought this one because I thought it might come up. Let me just read you one source, because this is going to be important, and then we'll be able to start to conclude. The Shulchan Aruch says as follows, the Code of Jewish Law. This is in Yeridea, Shin Lamed Tes, 339. It says as follows. The Shulchan Aruch says, Hagoses, someone who is dying, Harei hu kechai l'chol devarav. They are considered alive. Treat them as a living person. V'cholam ametz im yetzias hanefesh. Anyone that does anything that hastens the death, even though they're dying, harei ze shofech damim. That's murder. It's murder to kill someone even though they are dying. So that's one thing. But then the Ramah adds as follows: V'chein asher ligram lamesh yomos mehera. You can't even speed up the dying process. You can't make them die faster. They're dying for a long time, but their soul is not able to leave. They're still alive, but they're dying. You can't remove the pillow from them or the sheets or anything to help them die faster, because that's an action that causes them to die faster. Because you might think like, oh, maybe the feathers of the pillow are keeping them alive, so somehow moving it will make them die, or you move them to a new place. All that stuff, that's an action, and you can't do an action that leads to death. However, then it goes on to say, Aval, im yesh sham davar shegorim ikuv yitzias hanefesh. If there's something there that's preventing them from dying, their body's trying to die, but there's something preventing it. Kagon sheyesh samuch la'oso bayis kol dofei kagon chote veitzim, like there's a sound, a pattern, a beat, rhythm that's keeping them alive. Mutter lasiro misham. You could stop it. You could stop the sound. The sound is external. It's somewhere else. You can stop the sound. The aim is a ma'aseh klal, because then you're not doing an action. You're just stopping. You're preventing the preventation. Is that English? You're preventing you're stopping them from their soul from being prevented from leaving. Ela shemeser hamaneya. You're just removing an impediment.
Does that include giving oxygen?
What do you mean?
Patients get receiving oxygen by mask.
Oh, so you're removing the oxygen, right? So this is the debate.
I'm just saying.
Right, so this is the debate, that his argument, those who use this, they said, look, the tube is keeping them, is forcing their body, their soul is trying to leave, their body's shut down, and we are doing something that's keeping them alive. So just remove that and allow their soul to go. This was the argument. The rabbis didn't accept it for a few reasons. One is, the thing that was preventing the soul from leaving, we have to discuss in a minute, and then we'll conclude with that. One more point. Does the artificial heart fit into this category? They argued, the Ramah allows removing an external impediment. So someone's dying, the sound that they're hearing is keeping them alive, so we stop the sound. Then we just allow what will happen. They die. But we weren't allowed to move them, right? That's what the Ramah said you can't do. So is the tube in their throat, the respirator, is that something external or internal? The rabbis felt it's internal because you're moving it, you might hasten death, it's in them, it might be internal. Someone may say, no, it's external, it's not a body part, it's external, but this is a debate we could have. Others argued, this was only talking about a goses. Remember, they have to be someone who is dying. Some argued the category of goses is only someone who we know is going to die soon. But if they have an artificial intervention keeping them alive, maybe they're not a goses, because that artificial intervention is keeping them alive. So some wanted to say that this can't apply to respirators. And do you think, can that apply to artificial heart? I mean, if a respirator is considered internal, an artificial heart is for sure internal. So, and if they're going to stay alive, so this is something, as I put it on the sheet here, on page 7 here still. Right, we said, another thing that they said, some of the rabbis said, if the external object that you're removing, when you remove it, they die instantaneously, that can't be considered removing an impediment, because it's instantaneous. So those rabbis argued, you can stop a respirator if they'll live at least for some time, but an artificial heart, they'll die instantaneously. Right? And then you have the issue of, are they a goses, and the problem with that being external. This became up, by the way, you mentioned dialysis before. So there's a fascinating debate. Rav Shlomo Zalman Auerbach considered dialysis to be in a halachic status of kidneys. If someone was on dialysis for permanent dialysis for a long period of time, he considered it to be their kidneys. So he did not allow cessation of dialysis, even in between cycles. Most rabbis said, you can withhold, but you can't withdraw. Therefore, between cycles, like in the olden days, when a respirator was in an oxygen tank, Rabbi Moshe Feinstein said, just wait till the tank runs out, and then you don't have to put it in a new tank. Now it's in a wall, it's continuous oxygen, right? So that you don't have that. But so some rabbis said dialysis is the same. In between cycles, you just don't have to do a new cycle. But Rav Shlomo Zalman Auerbach, he was strict in this because most don't agree with this. He said it replaces the kidneys. It's now a person's kidneys because it's doing the function for them. And therefore, you can't stop dialysis even in between cycles. Most didn't agree with that. But I'm just saying, so they'll argue, so if that's true, then for sure the heart is now their heart. It has the status of the heart, and to turn it off, it's not just removing an impediment, it's actually turning off an organ, as we said before. Yes?
What people are less likely to allow the respirator because
Yeah, good point. This is a very big issue. People that don't want to go on a respirator because they're afraid, because of Jewish law, they'll never get off of it. So first of all, we always encourage people, if there is a chance, it is a respirator just like this artificial heart. It's supposed to be a bridge. It's not supposed to be permanent. No one wants to be in a respirator for their whole lives. So if there is a chance, sometimes you're right. Sometimes there's no chance, no real likelihood that they will ever get off the respirator. And then we agree. We encourage them, don't go on it if it's going to mean that you're never going to get off of it. But if there is a chance, there's a good likelihood that this could actually save their life, and then they'll get off of it. But there's that chance they'll become dependent on the respirator. So we have ways. There are halachic ways, which I don't think I'm going to go into now because I think it would take the whole shir to do. But we have. So I sometimes tell people in the hospital, if it's really a debate, like we're not sure, it could save their life, but we could get stuck. I tell people, do it, save their life, and then don't worry. We'll find a way. We'll help you find a way. There are ways, halachic ways, that we can sometimes find that can help. Usually, not always, but usually there are ways that it can be managed. Yeah.
I understand the thought that you're saying, if you remove the ventilator, they're gonna die.
Right.
But unless the doctors are playing God, without a doubt, they're not gonna know if every case, 100% of the time you remove the ventilator, that the
That's true.
patient dies.
Usually that's true.
So now what happens when the patient doesn't?
Right.
And all the decision was based on that. Again, the statistics and going forward and what one relies on, whether psychologically it's affecting the patient or the doctor or both.
Right, but that's usually
It's an issue of
but it's not a big problem. I mean, the point is you took the patient off the respirator. You thought they were going to die right away. They didn't die. So now you make sure that they're comfortable. And either you reassess and you realize, you know what, they're better off than we thought and we can perhaps save their life, or you ensure that they are comfortable and they...
Okay, but you have another line, which is, I think, very difficult to define as in comfortable and or suffering.
Yeah.
Who's really suffering? Is it the patient who we are certain we are making comfortable or no longer suffering? Or is it the external
Right.
parties who are observing
Yeah,
the
I mean,
patient
right.
and there to care for their loved ones who really are suffering more than the patient, especially if the patient is comatose or put in such a drug
Right.
state.
That's a good point. But in Jewish law, the only decision can be made only based on the patient's suffering, not based on the family's
I
suffering.
understand, but are we really?
Right. Excellent points.
Than Jewish or
Right. Good points. So let's go one more. I just wanted to say one other thing before we go to kind of conclude. There's one other interesting thing, which is the definition of death issue. It was mentioned before about brain death. So this is fascinating because it comes up in secular thinkers too. Even though in American law, I mean, brain death is accepted, right? And even though it's not totally in Jewish law by everyone, but this issue still comes up in American law in a fascinating way. So in American law, as I mentioned, there's two ways to determine death. Either one's heart stops pumping or there's no brain function. So it's either or right now. Some thinkers have argued, because of this artificial heart technology, we should change the definition of death and get rid of, completely get rid of the cardiopulmonary criteria. It should only be based on the brain. Forget about the heart. Why? Right? So it will make it less ethically problematic because if we only care about the brain, not the heart, then it becomes totally like a respirator because the heart doesn't matter. It's just the brain function, and once you turn off the artificial heart, the brain will still function for a little while. You didn't turn off the heart. You didn't turn off the brain. You didn't turn them off. It's just the heart. That's not what the definition of life is. Their brain. You didn't turn off their brain. You didn't remove their brain. And so some argued, because of these dilemmas, we should define death only based on the brain. Forget about the heart. That's not a helpful category. That's what some have gone so far as to argue. It's just interesting issue.
Is that popular?
I don't think so. But it's just an interesting, argument that was made. What about in Jewish law? This will bring up a couple important points as we conclude. So obviously, for those who accept death by neurological criteria, brain death, then if the person is brain dead with artificial heart, then of course, once they're brain dead, you can turn off the artificial heart. That's not a question. They're dead, right? So that's easy. Or there are those who will say, no, we don't accept brain death, but we consider someone who is brain dead to be like a ghosts, like they're dying because they're brain dead, so they're not gonna, walk out of here. So they're like a dying patient at the very least. So that school of thought will say, well, once someone's a ghosts, we can apply the Ramah that we read. The Ramah says you no longer have an obligation to save life when the person is dying, right? Normally, you see someone dying, we have to save their life. That's an obligation, right? But you don't have to save life of someone who's actually dying. So these rabbis would say, even though they don't accept brain death, but they would say, but such a patient is, they're dying, so you can passively allow that to happen, and then they could allow, these rabbis would say, so then you could allow either medications to run out, the battery pack to run out, you can allow that kind of stuff to happen, because it's just removing the impediment. Right? So there are those who would make that, they can make that argument. But as I said, I asked a lot of rabbis this question, very big rabbis, and they did not make this argument. This is just a suggestion that could be made. I'll tell you what they did say. So those rabbis who don't accept brain death, and now you have this patient who, and by the way, some of them, like let's say Rabbi Hershel Schachter at Yeshiva University, he doesn't accept brain death. He defines death, though, he doesn't really say it's a beating heart, like some say. He says it's circulation, if there's circulation happening. Now, obviously, circulation requires a heart, right? Well, no, we just learned tonight that it doesn't require a heart. So to him, he would say, well, yeah, as long as they have circulation, they're alive. It's not about the heart, it's about the blood circulating, right? So, what? Yeah, exactly. That's his argument. So I asked I'll give you some examples. I'll say their names. I mean, I published this already. I asked Rabbi Bleich, Rabbi David Bleich, who's an incredible scholar, and deals with these issues a lot. He is from the more one extreme camp. I'm not trying to call him an extremist, but if I would make a spectrum of views in the Orthodox community of brain death, the different criteria, he's on the far side in the not accepting brain death camp. And he says as long as there's any vital motion is the term they use, if a body has vital motion, it's alive. And I called him and asked him this question, and he sent it back to me. In fact, we worked out the wording because I told him I was going to publish it. And he said, this is a quote from him that you have on the page 8 here. He says, even if there's peristaltic action of the small intestine, meaning even if the small intestine, like how muscles pump, even if the small intestine is still pumping, that body is alive, and you cannot deactivate the artificial heart. So that's one. He would say you cannot turn this thing off. I don't care. You have this patient deteriorating in the hospital. You have to.
You would say the patient has rigor mortis and sits up in the morgue and he's still alive because there's still vital motion. I mean,
you'd have to.
Yeah, but it doesn't go on forever.
Right. But yeah, so that's one view. I asked Rav Zilberstein, Yitzchak Zilberstein in Bnei Brak, who's also considered one of the leading poskim today in medical ethics in particular, but in a lot of fields, and also if I would make a spectrum, he's closer to Rabbi Bleich in the spectrum, and I told him this exact case. This patient was decomposing. He said until their body really begins to decompose, if they have a heart pumping, even though it's artificial heart, they are alive. Now, I asked Rav Usher Weiss. Rav Usher Weiss gave me a fascinating answer. I want to just explain it to you, and then I'll give you some wrap-up, and we'll have any last discussion. And I'll give you some concluding points that I want to make. But his answer I thought was just brilliant. Because he says basically, the majority view of the poskim is that brain death is not death. That's the majority view. But he made an interesting connection. Remember, we're always looking for paradigm cases. Think about the case when someone's in surgery and they have a cardiac bypass. They're on a cardiac bypass machine. So when they're in the surgery and they have a machine pumping their blood for them, right? Not their heart. Their heart, in the case when their heart is not beating for them. So is that patient considered alive? So he says, well, it depends. If the surgery goes well, and they wake up after the surgery, and they're alive, they were alive the whole time. You would not say, oh, they were dead from 4 o'clock to midnight, and then they were alive again at midnight, and then they have a new birthday. No, you don't say they were dead for that during the surgery. You say, you look back at the situation, you say, okay, that's a living person the whole time. But what if they're in surgery, the person's on the cardiac bypass machine, right? in surgery, something happens, and they die. They can't be stopped. There's not, the surgery has to be canceled. I don't know the right word. You say, this is it. They're not going to make it. So you stop. But they're still in the cardiac bypass machine, right? So Rav Asher Weiss argued, you wouldn't say at that point you can't turn off the cardiac bypass machine, because you're saying now, oh no, they died. They're not going to make it anymore. For by whatever criteria, the exact how to determine it, he even said, like, I can't give you a list of exactly how to determine this. This is not easy to determine. But you wouldn't say you can't turn it off once the surgeons say, like, oh, this patient didn't make it. Even though you have the cardiac bypass machine trying to work for them still, you would say you can turn that off. So he said, so to the artificial heart. You have to make a case-by-case decision, he said. Look at the patient. In our case, we had a patient who had no kidney function, right? He's on the continuous dialysis. He can't breathe. He's on the respirator. He has an artificial heart. He said, look, that patient's not alive anymore. How can you say he's alive? Yes, he has some brain function, but this is now a corpse. But if you have a case where someone is salvageable, I know there's a lot of gray area here. I know I'm not giving you a specific answer, and the truth is I don't think we want to give a specific answer. It's case by case. But some cases you say, look, this person is still alive, even though they are artificial heart, and you say, no, this person is not alive anymore. But I think it's a brilliant comparison between the surgery case to say, because he found a way, the point is he found a way to say, you know what, sometimes a person could have heartbeat, well, artificial heartbeat, and you're going to still say they're not alive, even though normally, anytime there's a heartbeat, they're alive. But no, he argued, this is different. We got to admit that this is different. And even though I say, if you have a heartbeat, you're alive, if it's an artificial heartbeat, lav dafka. Might be cases where you're not alive, even though you have this heartbeat, and therefore you can turn it off in some cases. That was his argument. Fascinating. I thought that was just fascinating. Dr. Avram Steinberg from Shari Tzedek, when I discussed this with him, and I told him about Rav Asher Weiss's, he actually told me that the Shevet Levi, Rav Vosner, the Hasidic posek from the past generation, that he told him once that in a case, he said he didn't accept brain death as death, but if someone had an artificial heart, then he would accept brain death. So there were even those in the anti-brain death camp who would accept brain death in this case.
Just a tangential question. All of these poskim who don't go by brain death, do they not allow organ transplantation?
Right. So if they don't allow brain death, they don't allow heart transplantation.
Only after circulatory
Exactly.
cessation.
That's the entire problem with heart transplantation and the whole point of brain death and is the issue of transplantation, right? They don't allow
Well,
it.
you'd accept it from
Well, then
somebody else.
it's considered cadaveric.
Somebody else who. no.
Right.
But if-
Not all of them, though. It's a big ethical issue. Will they allow you to accept it if you can't give it? And some don't allow. Some don't allow. You can't. They'll say, you know what? I think it's murder to accept a transplantation from someone. DCD organ donation will for sure be off limits. But any brain death organ donation will be a problem until their heart has stopped.
The interesting thing to me is that we will all accept, if all the cells died in the body, there's no exchange of oxygen, the muscles don't contract, all these irreversible changes in all the cells.
Yeah.
We can all say, this is death. Everybody could agree upon that definition. I'm just saying, irreversible changes.
Yeah.
Then you get down to the point is which organs have to have irreversible changes.
Yeah. Which are the vital
Before
organs?
we call it death.
Right.
And then if you have artificial situations where you can do what the heart does, and the lungs, you can do artificial situations, you can do what the lungs do. And I think the criteria for what is death, heart and lung, is the wrong criteria. And it's due to lack of knowledge by the rabbis when they were making this decision originally, because they didn't have the knowledge of exactly what.
Well, it's not a medical decision, though.
Well, where's the
The
Torah?
definition of death is not a medical decision.
Where's the Torah? What's the pasuk?
The pasuk is kol asher ruach chaim ba'apav, that the person can breathe. It's based on the story in the Gemara about where you have to check when a person dies, to see if a person is dead. You have to check for their breathing. It's all about breathing.
Right.
Life.
So
Is it their brain, the fact that it controls breathing, or is breathing a sign that their heart is pumping?
I don't think they knew that the brain controlled breathing. I think
Well,
if
obviously-
somebody stops breathing, death will follow. That I understand. So they see the person not breathing, they say death will follow. but I don't think they understood the complete function of the brain in terms of keeping the person.
Right, well, that's a big debate, and that's an argument that has been made, and it's a valid argument. But the point is that the definition of death is a religious definition, and that the medical job is to determine the criteria to determine that definition. So the rabbi's job is not necessarily to know the medicine, but it's to determine what makes a person considered to be alive, and when is the soul there, and when is it not, and they determine that it basically has to do with breathing. But then it became a big debate. As I mentioned, is it because the brain controls breathing, or is the breathing a sign that their heart is beating, and that's what determinant of life? But yeah, so let's just conclude now, and then we'll have more discussion. The concluding points that I just wanted to make are that. First point is that, this is a massive ethical dilemma, and it's just crucial to stop and recognize that. There is a challenge in the medical world that there's so much we can do, and it's a beautiful bracha, a blessing from God, what we have accomplished. We can do so much wonderful things, but sometimes there's a tendency that because we can do so much, we don't ask just because I can, should I? And we go too fast and too far, and sometimes we need to stop and reflect about, is this always the right thing to do? And to have these discussions, as was mentioned, to have real, honest, open discussions beforehand, and this needs to be the deactivation of the artificial heart needs to be part of the discussion of the informed consent process prior to implantation. The next point is just simply that this is really a value-laden issue, and it's often made on the basis of religious and cultural values and norms, and therefore really needs to be decided on a case-by-case basis, and that this is really an ongoing discussion. I've shared with you that some rabbis told me, each rabbi that I worked with on this said to me basically like, here's my initial thought, but I need to think about it more, basically. So it's like a really kind of an open question, a challenging issue, but something that's worthwhile to think through and to debate a little bit, because I think a lot of these issues that we debated are crucial issues to really think through and have an understanding of as we deal with other